Hey, this is Brooke, functional medicine dietitian specializing in fertility, and this is the Fertility Dietitian podcast, where I help you uncover the barriers that are preventing you from optimizing your fertility and teach you how to work with your body to finally take home a healthy baby. Each week, I will be diving into different topics on fertility and sharing my perspective on physiology, metabolic health, nutrition, and lifestyle approaches that have helped hundreds of couples get pregnant even after years of heartache. My goal is to empower you with the knowledge you need to take back control of your fertility. Happy listening. Polycystic ovarian syndrome, or PCOS, is a metabolic condition. We know PCOS to be the most common cause of female fertility challenges, and women are often told that they will never be able to have children naturally with PCOS, but this is not true. This is far from true. It might be more challenging to conceive, but with targeted nutrition, exercise, and lifestyle treatment and support, women with PCOS can absolutely take home healthy babies, a lot of the time without reproductive technology. Okay, the best way to manage PCOS is by taking a root cause approach. I have worked with dozens of women with PCOS to find their root causes and give them a very sustainable action plan to help them manage their symptoms and reach their goals of weight loss, cycle regularity, and getting pregnant. And I want to give you a roadmap to be able to do the same. So, for an accurate PCOS diagnosis, you must have at least two of the following three criteria. So this is the rhododendron criteria. And I see PCOS misdiagnosed often. So really pay attention here. So first, having irregular or delayed ovulation or fewer than 8 periods per year. 2, elevated androgen hormones like DHEAS or testosterone. And 3, cysts on your ovaries, which is technically 12 or more follicles on each ovary or increased ovarian volume. So you need 2 out of those 3 criteria. If you don't have 2 out of 3 of these, but you have been told that you have PCOS, it might be time to find a new provider and dig a little bit deeper. I see a few too many PCOS diagnoses that should actually be hypothalamic amenorrhea, which is a completely different approach than PCOS. And in order to be appropriately diagnosed, you should have at least 2 out of 3 of these tests in order to determine whether you have 2 out of 3 of the initial criteria, which are the irregular or delayed ovulation, elevated androgens, and cysts on your ovaries. Okay. So the testing that can help you determine whether you meet that criteria includes an ultrasound to see if you have cysts on your ovaries, androgen testing, which can include free testosterone, total testosterone, sex hormone binding globulin, often abbreviated as SHBG, and DHEAS. Okay, those are your androgens that you want to look at. And cycle day 3 hormones, which include FSH, LH, and estradiol. A note on these cycle day 3 hormones, you don't have to have these for a diagnosis, but they are particularly helpful if you are getting a fairly regular bleed, since they can help determine whether you are having an ovulatory cycles or bleeding without ovulation, which would actually mean that you meet the lack of ovulation criteria when you might not have realized it due to having regular bleeds. Okay. Additional testing that I recommend to help determine the type of PCOS you have and how to best manage it includes insulin testing, glucose testing, ideally fasting glucose, hemoglobin A1C, which is a longer term look at what's happening with blood sugar balance, CRP, which is an inflammation marker, and a full thyroid panel. Are all helpful to determine the type of PCOS that you have. Just a few Things that are helpful to know about PCOS. 50% of women with PCOS have high androgen hormones, which can result in cystic acne on your chin or your jaw, male pattern hair growth on your face, and hair loss on your head, and increased cholesterol. PCOS is responsible for up to 90% of ovulatory disorders and 75% of all cases of anovulatory infertility. Okay, so anovulatory is determining whether you are having anovulatory bleeds, is where that cycle day 3 hormone testing comes in. And the majority of women with PCOS, about 74%, do not ovulate, often having drastically irregular and unpredictable cycles. So I should say, do not ovulate regularly. Okay. So most of the time, the PCOS diagnostic criteria is going to include irregular ovulation. So there are different types of PCOS, and this is important for figuring out your root cause or drivers of PCOS and how to manage your PCOS by ovulating regularly and getting pregnant and having a healthy pregnancy, which is always the goal, right? So the 4 types of PCOS include classic, which is chronic anovulation, hyperandrogenism, and polycystic ovaries. Classic non-polycystic ovary, which is chronic anovulation, hyperandrogenism, and normal ovaries. Okay, so you still have the high androgen hormones, you have your irregular cycles, but your ovaries are normal. There's no cysts on your ovaries. Non-classic ovulatory PCOS, which is regular menstruation, but you have high androgen hormones and polycystic ovaries. And then lastly, non-classic mild or normal androgenic PCOS, which includes those irregular cycles, normal androgens, but you have cysts on your ovaries. Okay. So the drivers of these types of PCOS are going to be really important to figure out for the best way to manage your PCOS symptoms, get those regular cycles, have those good quality eggs being ovulated to greatly improve your chances of conception. Okay, so first driver of the PCOS is going to be insulin resistance. Insulin resistance is the most common driver for PCOS. Causes of insulin resistance include stress, poor sleep, poor gut health, nutrient deficiencies, inflammation, or infections. You have insulin resistant PCOS if you meet all of the criteria for PCOS and have insulin resistance. Okay. Inflammatory PCOS. Inflammation plays a role in every type of PCOS, but it can also be a primary driver of PCOS. Inflammation disrupts hormone receptors and suppresses ovulation. It can also stimulate adrenal glands and ovaries to increase androgens outside of insulin resistance. Okay, so you might have inflammatory PCOS if you have elevated CRP and normal insulin response. All right. Adrenal PCOS, if you have normal testosterone but elevated DHEAS in the absence of insulin resistance and inflammation signs, then you likely have adrenal PCOS. Okay. Adrenal PCOS is associated with endocrine disrupting chemicals and genetic susceptibility. All right. This is a really common scenario if stress was high around the time that you went through puberty. All right. There are a lot of risks of not managing PCOS. Okay. So learning what your drivers are is a really important piece of management because it then will decrease your risks of unmanaged PCOS. The risks of not managing it and maybe just going to IVF without considering the additional health effects and risks, is really something that we need to be thinking about. So risks of not managing your PCOS include pregnancy complications. Okay, so 20 to 40% of women with PCOS, 20 women with PCOS are 20 to 40% more likely to experience miscarriage due to both the insulin resistance and the hormonal imbalance issues that it creates. There's also an increased risk of gestational diabetes and a higher risk of small for gestational age babies. There's also a risk that children are showing an increased morbidity and mortality also. Okay. There are also cardiovascular risks here too. So, which also impacts fertility, but outside of fertility, there are cardiovascular concerns too. 70% of abnormal lipid, um, 70% of women with PCOS have abnormal lipid profiles, meaning oftentimes they have high triglycerides and low HDL. Insulin resistance increases levels of inflammatory cytokines too, like TNF alpha, blood pressure, obesity, etc., which are all risk factors for cardiovascular events. High CRP and high lipoprotein A, which also impact your risk factors for cardiovascular events as well. All right. Endometrial cancer is also a higher risk for women with PCOS because there's often higher estrogen due to the variable ovulation or no ovulation, lower progesterone because of those irregular cycles, which impacts the higher estrogen picture, and high testosterone, which is also a contributing factor to endometrial cancer. Other risk factors of PCOS are also risk factors for cancer too. So those cardiovascular signs, inflammatory signs, for instance, are also going to increase risk of cancer as well. Okay, so as you can see, it's definitely important for fertility, but also for just overall longevity and health to manage your PCOS. So you might be wondering, how do I go about managing my PCOS? Okay, I know I need to find my drivers, but then what? Well, many women with PCOS are often told that birth control is your only option to fix symptoms of PCOS, like irregular or absent cycles, acne, male pattern hair growth. But birth control does not regulate your cycle or fix any of these concerns. It simply puts a band-aid on the symptoms. And what if you're trying to conceive? Fertility medication is often going to be prescribed because you don't want to be on birth control, but neither birth control or fertility medication is going to fix or manage PCOS or decrease any of the risk factors here. Okay, so covering up symptoms with an artificial hormone Band-Aid can actually make things worse, leading to additional health concerns like diabetes and heart disease. All right, so what do you do about it? Well, you want to manage your PCOS holistically, right? Finding your drivers so you can hopefully work with a provider to help you really individualize the approach. But no matter what type of PCOS or what drivers you have, you want to pay attention to these things, all right? First and foremost, decreasing your toxic burden, right? We want to evaluate our personal care, cleaning products, what's going on with things like laundry soap because we're living in our clothes all day long and we don't want to be soaking in those toxins through our skin that are really disrupting our hormones and our ability to ovulate regularly, for instance. Decreasing toxic burden goes a really long ways in managing PCOS. So this should be top of mind. Heavy hitters are going to be your laundry soap, your dish soaps, and also what you're breathing in all day. Okay, we can get deeper and deeper into this topic, which I do have a full podcast episode on supporting detox pathways and decreasing toxic burden. So definitely go listen to that if you want to learn more about this topic, if it's new to you. Okay, improving sleep quality, also very, very important for how we are going to be able to manage that insulin response, but also be adapting to stress, decreasing our inflammation. So, really, no matter what your driver of PCOS is, improving sleep quality is very important. You want to be getting minimum 7 hours, ideally closer to that 8 to 9 hour goal per night of quality sleep. Easy to fall asleep, easy to stay asleep is the goal. If you're struggling with this is a big area to work on here. Focusing on strength training is going to be really supportive no matter what your driver is of PCOS as well. So, aiming for 3 to 4 days or sessions per week. You don't want to overdo it with exercise, but really thinking about muscle as medicine in this case is important because in an insulin resistance picture, our muscles actually like a glucose mop. So it comes in and is really, really helpful in how you're going to be managing that blood sugar. But if there's inflammation going on, if it's more of an adrenal picture for PCOS, muscle is going to be really supportive here. All right. And then outside of the strength training piece, and for strength training, I am meaning picking up weights. Okay. Pilates is awesome. Yoga is awesome. Body weight strength is definitely beneficial, but picking up weights is going to have the biggest impact here on managing PCOS. Increasing non-exercise activity time, also known as NEAT, is really helpful for PCOS as well. Thinking walks after meals, for instance, is going to be helpful. So just trying to maintain an active lifestyle as a whole is helpful. This doesn't mean rest isn't important, because it is. It's very important, but being mindful of how sedentary you are also is supportive of the overall management picture. Right? Eating for blood sugar balance, even if insulin resistance is not the main driver, and especially if it is, this is helpful for making sure that you're managing blood sugar either way, right? Blood sugar balance is going to be important whether you have insulin resistance or not, but especially important if you do. Right? This means focusing on protein, eating consistency, and food quality. We want to make sure that our meals are balanced with plenty of protein. Doesn't mean carbs are off limits by any means, but really focusing on the quality of those carbs, opting for complex carbs, which are going to be like our whole fruits, berries, our starchy veggies like potatoes, are all definitely good options. Okay, we want to avoid the refined, more processed carbs as much as we can. And last but not least, supplements. So supplements play a really helpful role in managing PCOS, but this is the one that really needs to be tailored to your drivers, as well as what other test parameters are for you, just what they look like. So starting with the above tips, decreasing toxic burden, improving the quality of your sleep, focusing on strength training, increasing that NEAT time, eating for blood sugar balance, is a great place to start. Outside of that, really fine-tuning supplements based on your overall testing and drivers of PCOS is going to be really, really helpful. And honestly, anytime we're adding supplements, they're only going to be as good or giving you that added benefit if that foundation is in place initially. Okay, so we don't want to be wasting money on supplements. We want them to actually provide us the supplemental effect of adding in benefit there. Okay. So if you are struggling to manage your PCOS, feeling lost, wanting to know what your drivers are to really get that individualized support and finally get pregnant and take home that healthy baby, I would love to support you. Thank you for listening to this episode of the Fertility Dietitian podcast. If you enjoyed it, please leave a review to let me know what topics you want more of or less of. If you want to keep learning, subscribe at Apple Podcasts, Spotify, or wherever you listen to podcasts. Check out my website for more info on my private coaching program, Master Your Fertility, or my membership community, Fertility Blueprint. And don't forget my digital store. Come say hi on YouTube and Instagram. See you in the next episode.